School systems are looking at opening back up in about a month or so, and many parents are concerned about what to do. Joining us now is State Health Officer Dr. Scott Harris. Dr. Harris, thank you for joining.
Thank you for having me today.
Could you please bring us up to date on cases right now across the state?
Sure, absolutely. At this time, we have more than 35,000 cases in the state. We passed 1,000 deaths, very sorry to say, of Alabamians, and I'm sorry, 45,000 cases, I meant to say. So numbers continue to increase.
What's your recommendation for high school athletics? We understand the Alabama High School Athletic Association is meeting this week to devise a plan for football this fall. What should they do, in your opinion?
I think we do have concerns about how that's going to take place. We've certainly tried to give our best guidance on that. Ultimately, there are some things that are going to be difficult to do in a completely safe fashion, but we hope they'll be able to do them as safely as possible.
As numbers rise to a certain level, would you call for school systems to move to all virtual learning in the fall instead of reopening school buildings?
Certainly we'll have recommendations on that. Ultimately, those decisions are going to be made at the local level by local school boards with the help of their superintendents. But certainly we want to make sure that people have the best information about disease transmission in their communities so they can make the safest decision.
You've mentioned that the increase in cases is not due to testing. Could you please talk a little bit more on that?
Sure. Actually, the percentage of tests that we're doing now that are positive is higher than we have ever seen it so far. So almost 12% of all tests we do are positive. So even though we're testing more test results are returning positive, and that explains the increasing numbers that we're seeing.
Okay, and finally, for parents who are concerned and who are worried about sending their child back, what do you tell them to do? What should they be looking at? That kind of thing.
We want people to follow the same guidance we've given for everyone else. We would ask people to try to maintain 6-foot spacing when that's feasible to do that. Be careful about sanitation and hygiene. Be especially careful to keep kids at home if they're sick or have any symptoms. As society opens back up, we know we're going to encounter some outbreaks from time to time. So work with your school nurse, your school officials, and with public health so that we can protect people as much as possible.
State Health Officer Dr. Scott Harris. Dr. Harris, thank you for your time.
Thank you for having me.